Hello, you're welcome back to my channel. So in today's video we'll be discussing about what can you do to prevent sexually transmitted infection and pregnancy after unprotected sexual intercourse. So before we go into details, please, if you have not subscribed to my YouTube channel, please do so. I'm on YouTube at Daily Head Guide and on all my social media handle at Shuaibu Omoko. So without much wasting time, let's begin. Today's video will be like an interactive season where we discuss about, we explain a lot of information regarding to this unprotected sexual intercourse and how to prevent pregnancy and sexually transmitted infection. Before we dive into the details on how to prevent sexually transmitted infection and unwanted pregnancy after unprotected sexual intercourse, let's ponder on this theory that has been going around by many people believe it. The theory is all about going to urinate immediately after sex can prevent infections. Most of the people believe that going to urinate after sex can prevent sexually transmitted infection. Let me explain in details for you. Going to urinate after sex cannot prevent infections. It can only reduce the risk of infections. Okay, that is for men, because men have only one hole in the penis, which is called meatus, the urethra. So this hole serves as a passage for urine and sperm. So in terms of sexual intercourse, whatever thing that sticks within this hole, urinating after sex immediately can flush it out, but cannot totally get rid of everything. And secondly, when you are indulging in sexual activity, you must have, you must have done some foul play. You must have engaged yourself in some foul play, touching here and there, and at the end of it, maybe you touch the breast without even washing your body. The same breast you touch, you suck the breast. At the end of it, you have swallowed something from there. So you have swallowed something that can go into your system and cause infection. Whereas in terms of female have two holes in their private parts. That is the opening to the urethra and the opening to the vagina. So when sexual intercourse takes place, it is the vagina sexual intercourse takes place, not the urethra. The urine comes out from the urethra. Then how come can the urine that comes out from the urethra flush out what is inside the vagina? So because when a man ejaculates, it goes directly from the vagina, it goes directly into the womb and stays there. So any infection from the man, it goes directly into the vagina and to the womb, of which it will be there to grow and develop. So how will the pee after sex get rid of all those things? It cannot get rid of them. Some people believe that washing the vagina immediately after sex can also prevent sexual intercourse. Do you know that washing your vagina, you are exposing yourself to more risk? Like I said in one of my videos, what we call lactobacilli is a bacteria which are present, a normal bacteria, normal flora bacteria present in the human body. These bacteria help producing lactic acid. This lactic acid helps maintaining the pH level of the vagina between 3.5 to 4.5. And this acid prevents any microorganisms that are capable of causing infection in the woman's vagina. That is, even the fungi, Candida albicans, are minimized as a result of this lactic acid. So getting rid of them, washing your vagina is getting rid of those lactobacilli, that's normal flora. At the end of it, it render the vagina more vulnerable to infection compared to the way you think washing will prevent infections. So it did not prevent anything. It did not prevent anything. So having said that, do you know that sexually transmitted infections are caused by different microorganisms? That are the one caused by bacteria, that are the one caused by fungi, that are the one caused by virus. So the one caused by bacteria, the one caused by fungi can be treated. But that one caused by virus, some do go on their own, while some remain forever, like HIV, sometimes hepatitis B. When it gets to chronic stage, it remains in the body system forever. However, in terms of HIV, when you have sexual intercourse with somebody that is you suspect to be positive or to be reactive to HIV, you can talk to a health personnel that what we call post-exposure prophylaxis is a treatment given to those who is exposed to HIV. So when you talk to a health personnel and if possible they carry out more investigation and conclude that you can go on this post-exposure prophylaxis, taking the dose within 74 hours can prevent HIV. So that is for HIV. However, in terms of bacteria and fungi, there are no any prophylactic treatment that can prevent it, and you will not even know whether you have infected within the short period of time. It takes 2 weeks for signs and symptoms of bacterial infections to start manifesting after unprotected sexual intercourse. But the good of the bacteria is that they are treatable. All the infections are treatable. They have medications, antibiotic, either injections or drugs that can get rid of them. So after exposure or after unprotected sex and you suspect that the person have sexually transmitted infection, then you are to go for MCS to get yourself tested. You are to go to get yourself tested 2 weeks after sexual contact. In terms of hepatitis B, the sign and symptom can come us within a week or 2 weeks. But that of HIV, the sign and symptom will take like a month, 2 months, and even 3 months before you start experiencing it. But I see some people after unprotected sexual intercourse with somebody they suspect that the person have HIV, they'll just rush to the laboratory to do HIV test within days, some within 2 or 3 days, hoping to see that maybe the result will confirm that nothing is there. If you go there to do this test within this short period of time, the result will surely confirm that nothing is there. That nothing is there because how what we call window period. Window period is that period when the infection is there, but it have not started, developing yet. So at this period, it's not going to show that they have any infections until when it is fully developed, like within 2 to 3 months. That is when HIV will fully develop and start to show at the person's body system. So, having said that, how can you prevent pregnancy after unprotected sexual intercourse? Yes, prevention of pregnancy after unprotected sexual intercourse is very, very easy. Very easy. But some people believe that maybe after sex they go and throw away pee or throw away something from their vagina that make them not to be pregnant. It's totally false. Because immediately after sex, sperm will travel to where it's supposed to go. And if it get into where it's supposed to go, whether you pee or you do this, you do that, it remains there. And if you did not take proper measure, the pregnancy will come unexpectedly. But the best way you can get rid of it, if you don't want to get pregnant, that what we call morning after pill is an emergency contraceptive, of which you have to talk to a health professional to direct you on what to do. It's an emergency contraceptive that you can take within 24 hours to 5 days after unprotected sexual intercourse. These can prevent pregnancy. It can help you prevent pregnancy. There are no any approved or correct method that can prevent sexual transmitted infection after unprotected sex. The best way you can get rid of sexually transmitted infection is to get yourself protected before sex. So even using contraceptive like condom is 50-50, cannot prevent sexual transmitted infections. Sometimes maybe now you put on condoms, you do a foul play, like some people have a foul play, some do this, do that. At the end of it, you already even soak in all the infections either from your mouth before the main actions, and at the end of it, you tell yourself, you say that I've used condom, and as time goes on, you start seeing some funny infections in your body system. So the best way you could get rid of it is one, before sex, know the person that you're having sex with. Make sure the person is free of any sexually transmitted infections. Get yourself tested and the person tested before indulging in sexual activity. And even with that, you can still go on to use contraceptives like condom just to protect yourself for more layer protections. So we have come to the end of this video, and see you in my next video. But however, before we go, please, like I said earlier, don't forget to subscribe to this channel